So we have Dr. Douglas Sanford. He is here with us tonight. He just joined us. And we've got Dr. David Zuckerman from Remy Laser. And we've got Sarah Braymeyer from 10 Toes Marketing and Remy Laser. And we are going to go ahead and get started. David and Sarah, do you guys have any notes before I introduce Dr. Sanford?
Well, Sarah, I was hoping that you could give a little background.
Sure.
Uh, is
Yeah,
that what would you what do you want me to introduce Doug, or do you want to?
I don't think it matters.
You can start it out.
Someone do it. And you can go ahead and introduce Dr. Sanford.
Well, I was just going to say a quick note. He's the owner of Maryville Spine and Laser Clinic in Tennessee. He's got a passion for cutting edge, non-invasive care. He leads a practice known for helping patients achieve lasting relief and improved function through advanced spinal and laser therapies. We're excited to hear from him today. He's going to talk about success factors that have his patients going from wheelchair-bound mobility to the ability to walk and drive independently. And Sarah, you guys said he runs 3 Remy laser units in his practice. Is that right?
Right now, yeah. I mean, so I don't know if any of you all that are online right now joined us for the podiatrymeetings.com Remy Roundtable in February. We had Dr. Sanford on, and we actually played a testimonial from a patient who was wheelchair bound and now is walking. And and then we also discussed that your medical assistants who are running the Remy are just going gangbusters, and you got a little like assembly line going on. And so an extra unit was necessary just to keep up with the amount of patient requests that you're getting. And I think when we spoke last week, didn't you say that, I mean, you're not even able, you're busted at the seams, right?
Yeah, we're probably about a month behind on evaluations right now.
Yep. I
So,
I want to just say something real quickly because I'm sure everybody's anxious to get into you know, I guess the meat, which that's why we're here tonight. This is going to be a conversation, but I've known Doug for a few years. I've seen him grow from 1 laser to 4 lasers, and he said something interesting to me today. It's all about getting outcomes. It's not about the money, it will flow. Outcomes, outcomes, outcomes. And we all know that neuropathy is difficult. My goal is to make it easier. I'm always looking to get the best that I can find with experience. And I'm just shocked at your experience, Doug. I never knew there was a hole. And, the chiropractic profession is amazing. We can learn from each other. And
of
that's,
course,
we can learn from each other. So I'm just very happy to have Doug here tonight, and it's an open conversation. I'd like you to tell your story and, give him a broad overview. We'll get into the clinical, but I want you to,
sure.
I'm just shocked. You have nurse practitioners,
Mhm.
you have all these patients, and you're getting great outcomes, but it's more than that. You talk to me, it's how you train each individual
Sure.
staff member, and we know this in podiatry. In order to get great staff, you make great staff. You train.
That's right.
And that really shocked me, how much time and effort and dedication that you put into it. And I admire you and I look up to you for that because it ain't easy, as they say. You got to put the time in order to get,
Thank you, Dave. Yeah.
and you've
And
done it.
so, I want to first start off by thanking everybody that's in attendance. It is an honor and a privilege to address such a high level functioning group. And I will start off by prefacing this by saying we don't do any chiropractic in the office. Not that we don't love it, we just don't. So it's all laser based, and the outcomes are solely phenomenal. So I'll give you a little history on this of how I got started in it, and then we'll kind of catch up to what some of the journey was like, and then where the practice is at now. And I'll try to be as frank and clear cut as possible. And so when I first got involved with lasers, these things were, Lord, they were boat anchors. I mean, they were huge. That's been about 12 years ago. And when I saw my first laser, originally being from Alabama, I've always been, you have to show me. Don't tell me, show me. And when I saw my first laser, I just rolled my eyes and I thought that was the biggest whatever, a bunch of hooey I'd ever seen, because you talk about light. And, what comes to mind is, well, why can't I just walk under the sunlight? Now, this was years ago, but I saw the outcomes that a friend of mine was getting. And he was a friend of mine I went to school with. And he went and did something called a carrot neurology program, which is kind of big in my profession, but it's no joke. It's 3 years of hardcore training to get through that program. You know your stuff. And so he had a laser, and this is back, like I said, a long time ago. And I spent about a year in his clinic, and I saw the outcomes. And I was like, okay. So, fast forward several years, I got my first laser, and I think it was a 12 watt or a 10 watt. It didn't have a lot of juice, but, long treatment times. And so we started doing some knee work and different things with it. And so I saw some definite results, but took a long time to treat it. About 2 years ago, we got into, I had been in his clinic and we really started focusing on neuropathy. So the first thing I did, since this is a neurological condition, it's not something we were trained on in school, I purchased a course from a doctor that had put together a very well-rounded course. And I spent a couple of hundred hours learning that course. It's 16 modules. And boy, I tell you, every time I went through a module, I'd learn something else. And so I went through them until I didn't learn anything else. It's probably spent 100 or 200 hours. I mean, many, many hours trying to really get my mind around this, because if I was going to solely treat this and take people's money to treat a condition, I wanted to know I was bringing the best of the best. And so I had a Remy laser at that point. I was in a musculoskeletal practice down in an area they do a lot of industrial boats and different things like that. And so we were using this when I first met Dr. Zuckerman, well, several years back. And boy, I was getting some good results musculoskeletally with plantar fasciitis, lateral epicondylitis, different things that were, out of my scope. We didn't get good results with. And regardless, so I had one. And we started our neuropathic protocol. And boy, I dove in and started looking at things and doing things. And I will tell you, we started doing a little bit of advertising, not much. And every time we did it, we would run one advertisement and get 15 new patients in the door. Well, 10 would start the protocol. And so at that time, I was using, and let's just back up for a second and define the neuropathic disease process, or the underlying cause of what I believe and that I've been taught is the root problem with the numbness, paresthesia, cold, burning, cramping. Etiology obviously can be a lot of causes: diabetes, Guillain-Barré, esoteric diseases, Agent Orange, chemotherapy cases, alcoholism, heavy metal toxicity, lots of different causes. But the root etiology of the discomfort, numbing, burning, all that good stuff is defined in one sentence. And it's a high dollar word I don't use a lot, but we call it epineural hypoxia due to microangiopathy. And when you break that word down, it really gives you an understanding of why these lasers work so well. So obviously the epineural is the, myelin sheath surrounding the nerve. Hypoxia, pretty straightforward, lack of oxygen. Microangiopathy is that small blood vessels, have a disease process. So to me, the reason why these lasers work so well is a couple things. The different wavelengths, you're going to dilate the blood vessels that are constricted, not giving the nerve the oxygen. So that's an immediate thing. And then it's also circulation. A lot of these wavelengths are circulatory based. So when you hit the two, and don't even get started on the mitochondria and the adenosine triphosphate that's released with that class 4. So not only are you dilating the blood vessels, giving the nerve the oxygen it needs, then the laser actually hits the nerve, and boy, it's a 1-2 punch. So I'll tell you the process of how we have done so well in practice. And we've actually got about 8 boot stations feeding 3 active lasers, and we almost need another active laser. We're backing up a little bit with that. So Sarah was right when she said production style. In high school, I worked in a speaker box factory, and boy, I tell you what, we could build some speaker boxes, And so I was always set the pace in there. And so it's production. It just is, along with quality of care and checks and balances to ensure nobody slips through the cracks. So with that said, we'll do an intake. New patient will come in. And I will tell you, I want to say we average right now about 22 to 25 intakes per week. Somewhere we're at max load. I can't see any more new patients. It's just there are not enough hours in the day. So we'll do the intake. We do a simple neurological evaluation. There's a few different ways to do it, but we found a pretty simple way to determine how bad they are, how wasted that nervous system is in the in the feet. And it gives us a score 0 to 100. So 0 is real good and 100 is real bad. And we'll also look for discoloration, different things that give us a clue of how far that patient has progressed down the neuropathic protocol, because you all realize it is a chronic progressive degenerative disease, just right out of the gate, that can, not always will, but can lead to amputation. So we have to determine how far along the neuropathic process the patient is. So we'll do that with a neurological evaluation, looking at the discoloration, different things like that. If the patient has lost under, say, 85 to 90% of sensation, in other words, they still have life left in the nerves, we'll go ahead and treat them that day with two types of, we use the Remy laser, but we also use an IR system. And, lasers are basically functions of power and wattage. The IR system takes longer. It's a superficial thing that its claim to fame is it does a great job of dilating the blood vessels. But the Remy's, what they do is in 12 minutes flat, they get the power into the nerve and the patient's nerves start to wake up. And I promise you, when that patient comes back in 2 days later or 1 day later, within 48 hours, 90% notice a difference. It's immediate. And they sign up for care because, they're frustrated. They've taken medications that are a mask, a cover up at best. They do not reverse the neuropathic symptoms. And so a lot of them can't take the medications. So they're looking for answers and they've been lied to and bought this and bought. But when you actually give them some relief, boy, they come in and, we've had grown men cry the first day. And we have taken patients that were in wheelchairs and had them be able to walk again using these lasers. So they are the real deal. Without them, we would not be able to do our work. And we recently added, and I'll shut up here in a minute. If y'all can't tell, I love neuropathy. I'm excited
Doing
about it.
great. Doing
Go
great.
ahead. So, it is a passion. And so, with that, my mom had it before she passed away, had it real bad. And I didn't know that there was a solution, so she was diabetic. And, if I had known that, obviously I could have helped. But so regardless of why I didn't, I didn't go to school to treat feet, guys. That was not my objective. So it's just something that I got into and fell into and have a real passion. But I will tell you, the bottom line is our clinical success rate is out. It's off the charts. It's out of 10 patients, about 80%, 8 out of 10 will get an 80% resolve in a 9-week protocol, and it's more permanent. If they keep the A1C in check, if they do some minor alterations to their lifestyle, we don't see these patients. I'll see them 2 or 3 years down the road, and I'm like, how your feet doing? Oh, it's doing great, but my shoulder's messed up. Can you fix that? That's what I'm hearing clinically. Now, what I will also tell you is if you look at the class 4 lasers, and I will compliment Dr. Zuckerman on his laser, and what I'll tell you about my homework on lasers, this thing is a workhorse. It is a Lord, is the Mazda or whatever engine, Nissan, and what you think of a dependability and durability, that's what this thing is. And his support is amazing. There's never been a time I've had a problem. He's not been on the phone, FaceTime, and fixing this, getting us up and running. Now it's been rare that I needed him, but when I did, that was the biggest thing. Was a year or two later. He's always been there, so that's been a great resource. And so regardless, I'm trying to think what else are the basics. So, you've got to have if you're going to treat neuropathy, first off, if you're going to do it, do it. Don't mess around with it. Don't dabble in it, or you be dabbling your whole life. And so, and this is just my experience, we run a neuropathic practice. That's all we do. I mean, I'll treat maybe 10% some other stuff, but just be good at all you got to do is be good at one thing. And if you're good at that, they'll find you. And so regardless, so it's a 2-day protocol. I do see some doctors using things called shockwave to treat neuropathy. I've got one in the office, hadn't seen the results. I see other doctors doing it different ways, and that's okay. This is just the way I was trained. And I will tell you in that, yes, we are bursting at the seams. So
Yeah.
I'll stop for a minute and just take a breath.
Yeah, I want to ask you some questions that
Yeah,
because I want you to prove me wrong because you
for
just
sure.
comment. I don't think you can cure neuropathy. You can control it.
That's correct.
That's what we've been taught. You just mentioned
Mhm.
one case where a couple years, hey, my feet are great. You know,
Mhm.
um, I always say, when you get the patients in it, we'll call it a controlled state. When do you see them
Sure.
after? I mean, do you see them on a regular basis? Like you go to the dentist for a checkup, or you may go to check your blood pressure. To me, it's a disease.
Well, here's what I tell them, and this is what I've seen clinically, is that what you're dealing with, the underlying process of what you're doing is creating angiogenesis.
Exactly.
And so the IR systems, and this is just my homework. Now, somebody on this webinar may know more than I do. Let me know if I'm wrong about something. If I'm wrong, tell me. I'd love to look at things and love to research it. But my research has shown that the IR systems create angiogenesis. So once you create angiogenesis in an otherwise disease, angiopathic system, well, now you've got more oxygen coming to the nerve. So unless they do something to mess it up, like they re-go through chemo, the A1C gets out of check, the nerve should, over the period of time, especially once you've used the class 4 on it, it should be a healthier nerve. But here's the other trick. We use something called the rebuilder. Now, we stand on a tripod. And what that is it's three different devices we can that are combined modalities that when combined, it's a 1, 2, 3 punch and your clinical success will be amazing, but you're not going to fix them all now. We'll have maybe 1 out of 15 that may get 20% better, 30% better, 40% better. So you're not, and you're not curing it. Obviously, you've got to look at the etiology first off. Is it a B6, a B12 deficiency? Was it Parkinson's? Diabetes uncontrolled? Is it controlled? So all that has to factor in. But what I've seen is no matter the etiology, if you create angiogenesis and use the Remy laser, they use the rebuilder at home, and that is a
Yep.
electrophysiotherapy device developed by a medical doctor, I believe it's Dr. Phillips, and it works on a 7.83 hertz. Its claim to fame is it automodulates, and so that's why it got I believe an FDA or a patent because it has a feedback loop, and the 7.83 is the frequency the nerves work on. It is not a TENS unit. So they use that at home. And I'll tell you, I'm going to just tell you how we came about that device. When I first heard of this device, I'm like, what is this? Why would I pay what we pay for that unit when a TENS unit is $19.95? So I looked into it and I took two of my toughest cases and I put rebuilders on them and they went home and those cases turned on around. So then I said, well, let's take anybody that's got over a 30 or 40% sensation loss and make them get rebuilders up front because sometimes I've had to see some of these patients 40, 50 times. And Lord, that got tiring. So what I'll tell you is since we implemented that, we average 18 visits and they're done.
Can
So
I
I
ask
wanted to kind of,
I want to ask you a question, and that's something that I can't get a hold of is that I typically for neuropathy teach, we do it in packets of 6,
sure.
twice a week for 3 weeks. If they're really improving or feel positive, we do another packet. I find the
Mhm.
chiropractic approach, at least the ones I know, and they're 18, 19, 20. There's a lot of treatments. In my
Mhm.
mind, I'm not saying there's a right or a wrong way or anything like that, but I want to discuss the multiple what makes you pick. Explain. Okay, let's do it this way. I'm your patient.
Sure.
I got
Mhm.
neuropathy. I can't sleep. I got burning, stinging, cramping. I walk into your office. Treat me. Tell me what
For
you're doing.
sure. So, we'll do the neurological workup. When a patient comes in, I tell them directly, you're going to come in for an eval. If I can help you, I'll let you know. If not, I'm not going to waste my time or yours. And if I can't help them, I send them away. I promise you, I don't take them all. We're too busy. And so I cherry pick my cases, ones that fit what I'm looking for as far as the nerve score, the color in the feet, and they also have to make a commitment to show up for the visits and use the rebuilder at home, or I don't want them. First off, get out.
If you want to
You're
get
gonna
good
mess up my
results.
clinicals.
That's
Do what
that's
now?
a, that's a very good point that you made. I used to have a friend of mine was amazing with orthopod hand specialist.
Mm-hmm.
He didn't do a carpal tunnel release nerve. They have to meet the criteria. That's
That's
it.
right.
There's no reason why you can't say no. I can't
Right.
help you, or let's
For
do.
sure.
You
Yeah,
can't.
if they're not all in, and I'll tell you, I don't think angiogenesis can be achieved in under 18 visits. It just takes time,
Or
especially peripheral nerve regeneration. You're really taking about 9 months if you look at and that's why we haven't used that device at home.
of treatment or time. It's two different things. Convince me that I need 18 treatments. Why do I need 18 treatments?
So I would just address that issue and say, with peripheral nerves, it takes up to 9 months to regenerate. Angiogenesis takes about 10 weeks, and this is the minimum that we're going to be able to do.
One of
Okay.
the things I really liked in the
Hmm.
last webinar that we did, Dr. Ellsworth, it wasn't necessarily about neuropathy, but mentioned it would be like taking an antibiotic and only taking 1 or 2 days.
Of course. Yeah, you either follow it through. Rarely do we see a patient respond. You'll see patients get better, and you'll have some come in after 4 or 5 days and be like, amazing results. But normally, about 18 visits. That's what we found clinically, that patients reach that MMI. And I'm going to tell you how we find out. Your nerve scores aren't going to get a huge amount. Let's say they come in at 60% sensation loss. If we can get them down to 45, we're happy with that. But subjectively, they're like, oh my God, I can sleep all night. I'm 80% better. And once they plateau at that 70 or 80, we PRN them. You know, but I'll tell you, it takes some time. And then if somebody doesn't respond, like on the back end, let's say we get some, oh, I'm 40% better. We'll say, well, let's keep seeing you once a week. And usually I don't charge them. If I've taken a amount of money, because Medicare ain't gonna, for me, Medicare doesn't cover a lot of this. And so if I've told those patients, I'm gonna work on your feet, I'm gonna work on their feet. So that's just being a man of my word and being honorable. Now, Lord, I've had patients, and it's rare, but I have some that have treated 30 and 40 times, and it just now we are looking to do some different things, but it's rare, but it happens.
Okay, so I come in. Can I expect it? I've seen this, and it could be the ones that are what we call responsive. And 6 visits,
Sure.
it's wow.
Mm-hmm.
You know, what percentage of the wows do you get within 6 weeks or 3 weeks?
30, 20 or 30,
Because
and they all complete their care plan for
they
sure. They all complete their care plan.
right. Because there's a
Yeah.
video, I don't know if it's the right. I mean, there's a video that eventually we're going to show of a woman. It was it was a podiatrist, friend of mine, Ivor Roth. And
Yeah.
how many treatments did she obtain?
I think she got one or two. I mean, she had, and what we call an excellent responder,
Yeah. What's the percentage of excellent responders, do you think?
20, 30, 20, 30 max. Usually what I get is when they come in that second day, I look at them and I say, tell me about any difference you've seen, any at all. That may be I slept better. I walk, it doesn't have to be a huge, I'm not, I walked on water. We're not looking for that. We're just looking for a change to say that the nerves pick the laser up. But I'm going to tell you the other thing too. Let's say they don't have a change. Let's talk about that patient.
Good.
Retreat them and retest. I promise you that test will come down from a 60 to a 50. Sign them up, treat them.
What test
But
was that?
the neurological evaluation.
Okay, and what
It's
is that?
old school test.
When you say neurological evaluation, what do you mean? What are you doing?
For sure. And so it's based on about 7 parameters. You're going to do light touch, heat, vibration, pinprick, Wharton's pinwheel, things like that. You can do some patellar reflexes. You can do a Romberg's or heel to toe if you want. We don't do a lot of those, but your neurologicals, there's a test, and I've got a video linked up, 2 different types of tests we use. But it's basically that, it's like listening to the heart with a stethoscope. There's no EMG. and you'll come up with a number. There's a scoring system. It'll tell you how bad that patient's feet are. And so let's say they come in and say, well, you've got 56% sensation loss on the left foot and a 65 on the right. That first visit, I promise you, if you retest that second visit, that 56 will go down. I've seen it drop 12, 15, 20 points. They have that much more sensation in the feet. So if you can have some objective data that says the nerves pick that laser up, sign them up. Treat them. You got it. Yeah, you've got you a good one there. So
Let me ask you another question. We're talking about lasers.
Yeah.
Is there any specific wavelength that you think is important to enhance?
you know, I would have to defer to you, Dr. Zuckerman. I know you're 810, with pain relief and things like that, and you're 980, I think, sir. I get them all. Sometimes I get them mixed up. I hate to admit that. I have to look them up when people ask me about the different nanometers. I'm like, hang on, let me go look at that. So I've tried to memorize them. I've got a brain blind. I know the 650 is more superficial,
Well, our
but
650 is
yeah,
infrared in our quads. That's a whole
yeah.
nother topic. I don't think the wavelength specifically means anything. I think it's the accumulation
I
of
think it's shotgun approach.
no,
I
you're
think it's
getting no, not
shotgun.
even that. You can get more power comfortably. It's all about power density.
Yeah.
And
So
you
you
can get
know more about that.
what?
You know more about that than I do.
Okay, I was just
I
curious.
just care that it works. I just bottom line, does it work or not? And boy, these things, like I said, they for the dollar amount on lasers, if you do your homework, your lasers, you stand behind them. They're workhorses. They're not. I mean, I'm not saying they're cheap, but they're not expensive for what they do. I promise you that.
But that's
Your
another
return on it,
topic. I'm a manufacturer, so I always believe
yeah,
you can't spend 30, 40, $50,000 on a laser that just does one thing.
right,
Return on investment, but that's a whole nother topic.
for sure.
I don't
It's just a great entry level, not entry level. It's a great laser.
Yeah. The first person that is considered in podiatry an expert is Steve Barrett. And I got friends with Steve Barrett for years. And, you know, we haven't had him on for a while. But his point was, and you've seconded this, you can't dabble in this. It's a group, it's a team approach. You're treating
Yeah.
the whole body, you're not just treating the toes. It's complicated. I'll give you just a little tip that I've been doing is, and podiatry might know this, when they operate on a foot, they're doing a posterior tibial nerve block. Well, I used to do laser or to get them. The whole goal is to get that blood kick-starting into the myelin sheath. Do you agree, doctor?
Of course, for
Okay,
sure.
so I'm doing what's called therapeutic. I call it the epidural of the foot. If they weren't doing well, I'd do a posterior tibial nerve block. It would raise the temperature of the foot at least 4 to 8 degrees and tremendous hyperemia. I use it for Raynaud's, anything circulatory. You can also check the sympathetic response or the tunica media within the arteries because they are contracted and you got to expand it. There's a guy, I mean, you want to read a book, a guy named Steinberg. Marvin Steinberg was the god. He's dead. He's probably in the 40s and 50s. He used to teach at the New York College of Podiatric Medicine. He taught
Yeah,
so, and podiatry has that option of really kickstarting it too. So there's lots of things that can be done. I like the fact that you don't have to stick a needle in the foot with you. I love
right.
that. And the fact you're getting great results. Now we have a lot of questions. Should I go through them, Sarah, or
Let me just want to wrap that up before just one more. What I tell patients is very simple. Let's say patient comes in for acute care. I tell them it's like a natural shot of cortisone, no side effects. Lay face down. That's how you do that. But you go ahead. Filled your questions. Tell me cortisone and pain reliever. That's what it does. But what kind of
degenerative?
questions we got?
Yeah, there
I,
are a lot of questions in here. I can start to read them off if you guys want to
For sure.
take them. All right. What is the name of the course that you mentioned that you took early on?
Lord, I bought it from a doctor that had retired, and it was a 16 module course. I found it on a YouTube video. Don't ask. I called him, and he was nice enough to share it with me. I don't know what I paid him a little money for it. But it was 16. I don't think there is a name for the course. I just got all the modules,
and
if that
can I
makes
make
any
a comment
sense.
on that? And this is
Yeah.
not prepared at all, but I'm listening to you because every time I listen to you, I was always taught many years ago. I had close friends that live in the South. Never judge anybody by their accent. you get smarter and smarter the more I talk to you. So I'm
Thank you, Doc.
thinking, and I don't want to trap you into anything, is that you could put a course, of course you'd have to be, it wouldn't be a free course, but if you could think, you don't have to answer me, at this moment, something I want you to think about where you would put a course together where, anybody that had the Remy laser or any laser, but it would start with the Remy laser that could study under you. Can't do this for nothing, but we could work something out. Would you be interested in discussing something that, considering something like that, that we could
Yeah,
talk?
just know that I'm not, I've got some young ladies that help me out, which, I know you do too. I'm never your attention to detail, Lord. I lost a job as a painter when I was 16, but I'm a big picture. I love I've no problem conceptualizing. So that's why I really hadn't developed a course, because it would take me sitting down and paying attention to the detail. But man, I have got tons of information that just here's a video, here's this, here's that. It's
I'm
at
thinking
at my
I think you're a
fingertips.
born teacher. I think you're a born teacher. You may
Thank
not
you.
know this, but I think you are.
Well, tell us a little bit about, because I know you're working closely with a physician in Franklin, Tennessee. Tell us a little bit about that.
She's been amazing. So, here's the thing. With her, um, she has a gift to be able to communicate with patients, and you can't teach that. It's something that's just, you either get it or, it's soft or, whatever. And so she's been super amazing I can just be like, oh, do this, this, and this. She's like, okay, got it. And she just goes and does that. And it just works. And so I know I think she's, treating a patient or two. And, I know sometimes when you start to do something, you got to put your toes in the water, because you have to, as a physician, know what you're saying is true. In our heart of hearts, if we don't believe in it and know it, well, that's a problem, and so, but she's just been super amazing to work with, and anything I give her, and I've learned as much from her, I think, as we've kind of traded back and forth. Super smart lady. Yeah.
Um, there's a few questions in here about coding. One is, what code do you use?
Oh, here we
Is there
go.
a code
I
for
know every code.
neuropathy?
I know I'm sure Dr. Zuckerman does too.
I
But
can go in 2 seconds.
go now, this is just me. I'm a 97039 guy. I'm not sure what you're gonna say.
I think the question is, what's the code for the laser treatments? Is that what the question means?
Yeah, there's a few different ones. Do you use CPT code, HCPCS code S8948? There's a which code do you use for laser treatment of neuropathy and pain? Is it different than nail treatment? All that kind of thing.
Yeah, well, I'm going to answer that very, very
Yeah.
in summary. You can do an evaluation management, but it's cash services. That's the bottom line. There is, when everybody's looking for the code. Okay. What's more important is the medical policy. Stop trying to, and I'm telling you, you're going down the wrong path, especially with Medicare, especially because Medicare does not cover therapeutic lasers. They may someday. When they do cover it, you're going to wish they didn't, but that's a whole nother story.
That's right.
But
100%.
my
Yes.
point is that it's an evaluation management to determine if the patient is a candidate for whatever treatment.
Yeah.
But as far as you're going to bill, every laser evaluation management, there is no laser code specifically at all. But it's based on medical policy. If you have an insurance company and you want to know what the code is, put that away and look up the medical policy, because that's what counts. You may think that the code's covering it, and you may get paid for it. There's a thing called post audits. You'll just give it back. I don't want to be the bearer of bad news, but one of the things with the Remy is I made it so affordable so that you could get a high return on investment, because in podiatry, it's multifunctional. Can you imagine being a chiropractor? You found a niche, but where you only can do pain and musculoskeletal, which is a great area. It's a great area. So the answer is there is none. Do you have anything to add to that, Doug?
I would tell you we're 95% cash, and patients don't mind. They're just fine with paying that cash fee. And we don't charge a small cash fee. We don't charge the most I've heard of, but we're not cheap. Um, and they have no problem paying it. And so I think a lot of times insurance, we all know it's getting worse and worse. It hadn't gotten any better since the 80s. And I use a 97039, which is unlisted modality. I don't know in the podiatric world, but we don't bill insurance. I'm with Blue Cross, and they global fee cap it, so who cares? But I'll tell you what they do cover is some of the durable medical equipment we use. And you can code some of that out and get reimbursed very well for some of the durable medical equipment for sure.
For example, what do
Um,
you by Durham Medical? Just give them a
yeah,
small.
so with the rebuilder, we use TENS garments for socks, and your allowables on the E0730-NU is going to be about $450 a month for 12 months. So right there, you've got about $4,000 worth of reimbursables. Well, you can get your socks, reasonable.
What do you mean by socks? What's that mean?
As a conductive garment, they have a silver lining woven in, and so they're going to need a pair a month because silver degrades. So if you're doing that on autopilot, that's going to give you per patient about
And who
4,000
does
a year.
Medicare cover that?
Medicare not so much for podiatrists maybe, but I hate to go out on a limb and tell you to do that, but I know
Sure,
anybody under
it is what it
65,
is. So it's
under
mainly
65
commercial.
commercial for sure.
It's commercial. Okay, I'm just
Yeah,
curious.
commercial is gonna be a high reimbursement rate with
One
that.
thing I want to do is because I've been around for a long time is I don't want to lead anybody down the road of thinking
Yes,
the golden
right.
goose of insurance coverage. I
Check your state laws.
I just
You
had a
know,
podiatrist. I don't know if he's on tonight. Asked me first. He asked me, "Can we use this code?" I forget the code, but I'll give you the story. It was basically for ultrasonic. The Remy is amazing for wounds. It's the best kept secret. The studies show that it's amazing. They were done at the podiatry schools, but the question was coding. Can we bill for? And I'm not going to get on my soapbox about this. It was ultrasonic debridement of a wound. I won't mention the company. I have my own opinion on this. How can you have a wound that you're getting paid 400 or 500 bucks a week for almost ever? The point is, you can get paid. The perfect thing is the amniotic grafts and stuff. They're going to audit you. My best advice to you is slowly get away from Medicare.
for sure,
Slowly,
100%,
because you're going to pay
100%.
the price.
Well,
You're
and
going
that's
to
one
pay the
thing that
price.
I always thought was really interesting that I was hoping that you could touch on a little bit, Dr. Sanford. Just because we get a lot of questions, or maybe just hesitation, like, well, I just don't think this is going to work for me because my patient base won't pay cash. My patient isn't in a high income, like a high affluent just city, and that's one thing that I think is just really key when you're talking about how much success your practice is having in these not perfect situations that are basically debunked by what you're going through.
We used to have an old joke in chiropractic college. We would say the problem's above C1. So y'all can figure that one out. The problem is your viewpoint is not the patient's viewpoint. I promise you that. So the problem is in your mind, you think that, oh yeah, they will. If you offer them a great option to relieve what they're going, oh yeah,
Absolutely.
yeah, for
Gabapentin
sure,
and
100%.
Lyrica are very they drug you.
Mm-hmm.
They're very difficult drugs. They're not great drugs, to tell you the truth. Now, I didn't mean to interrupt you, Ann. So if you want to go through the
No,
questions,
it's okay. I was just going to say there's a few questions in here all asking, what do you charge? If you don't mind sharing that or giving a ballpark or something.
For sure. So the average cost for neuropathic care across the country is about 7,000 cash. I think we're at about 6, but that includes a rebuilder. And so the rebuilder, I think I don't know what they pay for that. I know that if anybody is interested in using this protocol on patients, I know the rebuilder. They said something about give them a call and use the code DPM. Oh Lord, I forget what it is. I'm probably get a text message, and they'll give you some discounts on those devices. But I can look at it here in a minute. But regardless, we charge about $6,000 and it includes a rebuilder. The cost of goods on us, we charge probably about 500. Now, if they pay up front, we give them a little 10% discount. So 5,500 all in. But we're a little bit cheaper than a lot of. I've heard people charging $10,000. I'll just be honest with you, and getting it. I think
Yeah.
I don't know that we need to do all that. But yeah.
What's the Remy protocol for foot neuropathy? How long, what strength, and what part of the feet.
Oh, you'll love this one. We ran lasers so much. I tried to figure this code out. We run lasers so much. My main clinician, her arm about fell off, and she got epicondylitis so bad. So we had to go to hands free. That's the only way we could do this. So we
Yeah, but
installed three. Go ahead.
I want to explain something to you. Remember how we brought down, first we were doing the common perineal, the sural nerve, the tibia, and you were so busy that we turned it into just the whole bottom of the foot. Are you doing the whole bottom of the
Right.
foot? What other
That's
areas
right.
are you doing?
Yeah.
You're just doing the distal fibers planarly?
Yeah, we were doing distal, but I'll do the calcaneal, right, the calcaneal too. So we'll drop it down. We'll set forward four, so we'll do you know, the twinkle toes, the distal, and then we'll do calcaneal, so 4 and
You
4
mean the
for
tarsal
8 minutes.
tunnel? You saying tarsal tunnel, the medial
Not
aspect?
really tarsal. We just pointed at the calcaneus. So you
Really?
go on the plantar
Why would
aspect.
that work? Why would that
Uh,
work?
I don't know.
Yeah.
I don't know. I mean, I tell you, Doc, when we first started doing it by hand, we were doing the whole foot. So our thought process is, well, let's do the whole foot.
Effective? I think that's effective. I think you're doing 5 minutes per foot.
Yeah. Oh, hang on. I found that in case anybody's got a pen and piece of paper, the code is DPM 425. And what that does at the rebuilder level, it puts you in a lower, they're cheaper. There's tiers to rebuilder. And so the more you order, the less they are. But that is part of being on this webinar. They give you to them a little less expensive. But anyway,
What
um,
is a rebuilder since you're talking about it?
for sure. And so the Rebuilder is an FDA approved device for neuropathy. It was developed in conjunction with the Cancer Centers of America. It is just when we put that into our protocol, our outcomes were more stable. And we could see them less times, and it gave them something they could do at home long term. And so patients, look, Lord, they're going to pay $6,000. They want to leave with something, and so we make sure that they get that device and use that device. And we feel that clinically it's justifiable because, I put it into trials in my office and I saw the difference between having to treat somebody 40 times versus 18. I think you could take these separate modalities and some patients will get used better on a monotherapy. But when you put them together, game over. Your outcomes are going to be higher. Patients are going to refer. They're going to stay and get the treatment, and it's a great time. We have a golden retriever in the office, and we have a lot of fun.
So the rebuilder is more for home use.
What's that? The golden retriever or the rebuilder?
Both.
Okay, yeah, that's right. Yeah, he's over there somewhere right now. But
Well,
the
David,
rebuilder's for home use.
oh,
Yes, sir.
sorry.
Go
I was
ahead.
say you built I know that we've got a lot of Remy users online right now, which is fantastic because I don't know how many of you are actually using it for neuropathy, and hopefully this will encourage you to do so. But if you don't have a Remy, and one of the best things that David did is it's so turnkey. I mean, the Remy does so many things, and obviously neuropathy being one of them. But David, you built in those protocols so that when it arrives, you just go to favorites and it's right there.
Right.
Which
Easy.
makes it,
Easy.
I mean, just start.
Yeah, I trade everybody when they get the Remy in neuropathy. I'm always looking for better, and that's why we're talking tonight, better ways to get better outcomes. And
I think it's the combination. To me, this is just me. When you put the IR, and I will tell you too. Now, I've looked at a lot of different boots. Okay, we used Healthlight for a while, and they were a good boot, but they've got a round diode, and I didn't find the service. The service was not there for me. Okay, the boot would break. I would have to send the boot back and wait for a replacement. I don't have time for all that. Something
when are you
breaks, y'all.
using the boot? When are you
So we
using
use a company called Bedrock, and Bedrock, it's a flat diode, and the boots are durable. It's all get out. Now, can you find a cheaper boot? Sure. Well, I'm gonna tell you, for our goal, man, I need durability.
Yeah, we're talking
And
podiatry.
so,
I don't know how well they know what an IR boot is. When are you using
oh, I'm sorry. It's akin to the old anodyne therapy, which was used back in the day. So an IR boot is an infrared boot. It's a low level laser. It's a class 3, and so it's going to
LED,
have that, I
right?
believe, 880 in there, but it doesn't have the oomph the Remy does. So the
An
treatment time is
LED?
very long.
Is it a laser or an LED, the boot? I thought they were LED lights.
Look, think I want to say it qualifies as a laser by definition, but it's a class 3, so it's a non-coherent beam.
Okay.
So, it's gonna do this and not generate heat. So your treatment, I use those for 28 minutes. So when the patient comes in, we're gonna put them on an IR boot, just an infrared boot, and I use a certain boot for 28 minutes. Then we use a vibration plate that was developed by another neurologist, neuropathy guy. It's a specific plate that does things. So that's 38 minutes. Then we use the Remy for 8 minutes per foot. So their treatment time's about an hour in the office, and they're treating at home. And Lord forbid they alter their diet, man, it's game over. You're going to see a high clinical success rate. So it's a protocol. It's not just one thing.
Yeah, I realize
it's-
that, and I realize that
You
100%.
know.
So what do you when they leave your office? Okay, so repeat this in summary. They're getting the proprioception plate. Is that a good way to describe it?
You could call it a proprioception. Now they don't take that home with them. They use that in office.
Okay, the infrared boot, which you start out with. Do they do any infra? What are they doing at home? They leave the office.
Just a rebuilder.
The rebuild.
Just a rebuilder. Unless if you've got a patient that comes in with blue and purple feet, my God, you better think about an IR system at home, and you better think about it quick, or they may lose that foot. Once you start to get discoloration and you've got stasis, I would send them home with a rebuilder and they make a Bedrock makes a at home boot. The ones I use also have PEMF in there, so they've got a magnet that's been wired for electric. So it's just the best of the best. I use the Pro Series in the office. I think we got about 12 sets, but they make one at home. But like I said, once you start to get discoloration, watch it. You better get that patient under care. If not, you know, it's not good.
I'm more what's the word? Allopathic trained, meaning that if somebody came in with a purplish foot, I would immediately I would either refer them to a vascular doctor or order a lower extremity arterial vascular.
Let's say they've been cleared. Let's say they've been cleared and they come in.
Then you're going to have to. I would do exactly what you did.
That's how I get them. So most of them have seen their cardiologist and they've been cleared for peripheral artery disease. They've had the ultrasound done.
Yeah.
And they're in my office and I'm like, dear Lord. I don't tell them they're about to lose that foot, but we all know it takes one stubbing that toe one good time, getting up at night, going to the restroom, not feeling it.
If they have lack of sensation.
That's right.
Thing I don't have.
So
All my toes would be gone. I stub my toes.
yeah. And so just know there's a lot to this, but when I tell you, when I first started this, I had a mentor that I could call and he would always answer the phone. For my first 9 months, boy, I called him every day for the first 2 or 3 months. Man, I got this, because I didn't want to take a patient's feet and screw something and mess something up. And so at about the end of 9 months, I didn't need to call him anymore. And
That's
so
how I learn lasers. And
yeah,
that's why I brought up to you. Maybe we'll do a survey. I'm not putting you in any position, but I think you're a good teacher. You give the nuts and bolts. I'd like to see where maybe you could produce, some type of, we could help you with it, where you can teach the basics. So, a great teacher is somebody that can teach another person and replicate what they're doing. So that's my goal, is where they could you're getting great results. Okay. You're successful. This is not 1 year. I've known you for years with an S. I could look up when I met you. I could very easily, because I remember the first laser I sold you. I'm saying at least 21, 22. I'm not
somewhere in there. Somewhere in there. That's right.
I have to think this out a little bit as to how, with your permission, I'll present it to you. I won't say, hey, we're going to start this course and everything like that. But I'd like to make it simple, especially we don't want you a million calls. You're busy. I'd like to put some kind of program together where possibly we could have it where, the goal would be to replicate what you're doing. It works. You're successful. You got to replicate.
Yeah, so one thing we have not talked about, and we hadn't talked about marketing, we hadn't talked about answering the phones, we hadn't talked about staff training. So just so y'all know, my staff does all the work. I'll just be honest with you. I see the new patients. That's it. And I'm about to outsource that. Do what now?
Then you get the nurse practitioners and
once once the NP's trained up, I won't have to be a part of the neurological program anywhere. I'm moving on.
You're
I've
free.
already, I'm on to bigger and better things. So
You're
yeah, for sure.
free.
That's
Well,
right.
and I'm glad you brought up marketing, Dr. Sanford. Obviously, I can show when you bring on the Remy onto your laser, I can show you examples of the portions of the marketing kit that you get that are specifically related to neuropathy. But
Sure.
one thing in the last conversation that we had too, Dr. Sanford, that kind of I was surprised. You told me a little bit about the marketing. Obviously, it's not like Field of Dreams. If you build it, they will come. They have
That's
to be
right.
aware of it. And you said that you're still doing all like television and newspaper ads in it,
Oh
and it's
yeah.
working. But that's also
We
consider the age range of your patient as well. It's like
yeah.
what pond are you fishing in? If you're not fishing in the right pond, your marketing doesn't
You
matter.
got to hit the right pond, and you got to be fishing in 4 or 5 at once. But I tell you, we get so many new patients, we have to have a call center answer the phones. I can't answer all these calls,
And
and so
that's incredible. Like
you know,
I was just shocked because I mean I haven't recommended a newspaper ever. I don't know how
oh,
long.
right, and that's how we started, straight
So
newspaper.
I was like, "Great, I need to go." I'm going to go back to when I first
Yeah,
started in this
I've
industry.
got an
And
ad
go back
that
to
was
those
custom
recommendations.
wrote for a newspaper that used to just bang it out, and it's custom wrote for the protocol. I got it from a guy, then I edited it for Remy and all that. It's even got a picture of the. I think Dr. Zuckerman, you've seen, it's got a picture of the Remy right there. And so, but the patients read the ad and they're already semi-educated when they call.
Right.
We like that. That's good stuff.
That's the key.
I'm just here to let you know that I've done only one episode of Dr. Roth's neuropathy pain program, and so far the results have actually been amazing. Normally, I have just the thought of standing is painful. My feet hurt all the time, and I've had this for 20 plus years. We've done one round of his treatments, and already I have no pain when I'm sitting. I have no pain when I'm sleeping. When I go to put my shoes on, I'm not projecting that it's going to hurt. I can walk with so much easier, and I'm just so excited. I can't wait to continue with the program. The home treatments that you do are simple. Anybody can learn them. It's easy, takes 10 minutes, and just to be relieved of the pain is amazing. So thank you, Dr. Roth.
Kudos, Dr. Roth.
Yeah, and I have not talked to him to know exactly what he's doing, but I think we were on the same page last time we talked. But you know, my thing, it's got to be a combo. You can't use mono with this. So
He is on our webinar tonight, of course, and he's got his hand raised. Do you want me to move him over as a panelist so he can share a little more?
Yeah, I'd like to hear about this.
Yeah,
sure.
I think that this is probably the 20 to 30% wows. It's only a segment of the whole population. That's why I think screening is very important. You got to decide what segment of the disease neuropathy you want to treat. You want to just pick out all the wows? That's an idea. Okay.
Dr. Roth, Dr. Roth, you're with us now as a panelist. So there you go.
There you go. Yeah.
Perfect.
These are done.
Well, I want to thank Dr. Sanford. He was so helpful. I called him up after the last seminar I listened to, and I was just amazed at his treatment program. So he was just super nice and kind of answered the questions I needed. And I went and made the investment, bought everything and got everything exact. I'm doing exactly what he does. We haven't had a chance to talk. I sent him over that video. That patient's now had 4 treatments, and she went to Disneyland over the weekend. This past weekend, she came in today. She said she's never been able to go to Disneyland and not be in just terrible pain. And she was just walking around all day long. So that was the final test for her. But, after the first treatment, she was able to sleep. You heard her on the video. Is absolutely amazing. So thank you. Appreciate it. Wow. What a wonderful thing that,
so great to hear.
Patients with. Yeah. So thank you very much, Doug.
How you doing?
Of course.
Can you hear me? How
Yeah, I can hear you. Yeah.
you doing? I can't wait to go to graduation next month with your son. But I have a
Oh,
question.
me too.
I may have missed it. What was the medical background and the the duration of this patient's neuropathy? Can you give a little bit of background?
Yeah, over 20 years. I mean,
Sure.
she's been miserable. She told me that she thinks about every step she takes, and she's got to just think about it, and it's just buzzing in her head all the time. And now she said that's out of her brain, and she
It's like
is enjoying life. I mean, it's absolutely crazy. And I'll tell you a little background of how I got her as a patient. So I did my pain cure on her. She got 2 years worth of relief. And then it came back about a month ago or so, and I gave her some booster shots, and she improved. And I could have given her more shots for my pain cure, but then right around that time, I was talking to Doug, and I said, I've just heard about this new treatment, and there's a chance it might be able to just get rid of it for you for good. She goes, I want to try it. And so, I made a special price for her because the first few patients, I'm really just winging it. Yeah. So I just basically did it for next to nothing. I won't say nothing, but next to nothing. And, wow. I mean, it's
Are
unbelievable.
you just doing the plantar nerves? Anything else?
Yeah, I did exactly the same thing. I did 4 minutes on each foot, on the front of the foot, and then 4 minutes over the calcaneus, kind of where the plantar nerve goes into the foot in that area.
Knot of Henry?
Huh?
I think it's the knot of Henry you're doing.
Yeah, that area, exactly. But I mean, I'm moving it around, but I just so it takes 16 minutes on the laser, and why do anything else if this works so well? And so yeah, I think it's a combination of everything.
How often are you doing it per week and for how many weeks?
Yeah, I'm following Doug's protocol. It's 3 times a week for 3 weeks, 2 times a week for the next 3 weeks, and 1 time a week for the final 3 weeks. So you see him for 18 visits, and it's a lot of work. They're in the office there, an hour and 15 minutes. But I got it down to, this is my 4th treatment. We did it today, and I've got some really nice spa chairs, and we got it down. So the first thing she does is, so she never gets out of the spa chair. We're able to do all the treatments from that one chair. And so, I put it on vibration, the whole chair, and it heats up. And so she's just sitting there relaxing. And we just go through the protocol exactly like he told me, and I just do it. Nothing. I haven't changed one thing from his protocol.
I'll tell you one thing that I have to delve in this a little better is that the whole point is to produce angiogenesis, correct, Doug? And
That's my research for sure.
now, what I'm saying is, if you stimulate it, wouldn't it progress without going 18 treatments?
I don't know. I mean, I don't think so.
Okay,
I
let me
mean,
add something. I was
David,
involved in high energy ESWT, where what we did was which creates when you micro trauma the tendon. There was a study done where they did it on rabbits. They did it in a human too, but they started out with rabbits, and it was one treatment. They traumatized it, and I'm trying to think. They labeled the cells, and they saw the cells coming to the target, but there was only one treatment. So that's my basis on this. Maybe, one is traumatically induced to get neurovasculogenesis or neovascular. This is more photochemical, I guess. I don't know the answer. I'd like to research that really well.
I don't know that anybody knows that. I hadn't seen that answer, but I think, photobiomodulation, when you look back at the photochemical reaction, I think it just takes time for these things to occur.
Research that because
And I've seen some people treating at 40 and 50 visits. I promise you, 9 months, I'm like, good Lord Almighty, we could have built the Leaning Tower of Pisa in 9 months. So 18 visits,
Yeah.
9 weeks. That's like liquid nitrogen right there. That's pretty quick for, peripheral nerve regeneration, or at least getting it started to being healthier.
I'm talking about,
For me,
I just made a mistake. I'm talking about tendon neovascularization and not nerve.
Yeah.
yeah, different ball game. And for many years it was said not to. it was said it can't be done, cannot be done. Now you got the Mayo Clinic, having quadriplegics walk again. So
Yeah.
I mean,
I've
we
seen
know we've made so many advances, but you can alter this protocol, but I mean the thing is, why would you? It just works.
Yeah. Let
It's
me
a good
just pipe
thing.
in here. I'll pipe in here. I've been treating neuropathy for quite a few years, trying to get to the secret. And it's usually a one and done, like it's a monotherapy. And that's where I kind of learned it. I think, Doug's right on, is that you got to get if you're going to charge this amount of money, you have to get those kind of results. And
For sure.
you're right, David, X% may get better in 10 treatments, but you really want to have a high, you want to over please these patients. You got to, hey, you're asking for money, you got to get the results. And
I
so
agree.
I wouldn't mess around with the 18 protocol unless, you
But
could
your
prove other's, but I
your
think it's necessary. I really
your
do.
particular patient is pain-free right now, right?
Oh, she has zero pain. It's
Perfect.
unbelievable.
But
And
she's gonna go,
she's so happy. She's not going to say like, "Oh, let me quit now." First of all, she
Right.
signed up for a package and she wants to get the full package because I told her this is what it's going to take. She's more than happy to come in 3 times a week. And I told her, I said, you're going to have to be devoted and do exactly what I tell you, or I can't promise you, these kinds of results. And so she's all on, and she's happy as hell, because the idea is when she's done, I told her when she's done, she's done. She didn't have to see me anymore.
I would imagine too, having so many visits. I know a lot of times, it's like, okay, I don't want to be married to this patient. On the same token, it's so much easier to, I'm going to use the word cross sell. I mean, you're building a relationship with this patient in
Well,
sense too. I mean,
but
how much more could you do for this patient? And you're building a relationship. They're going to be referring all their friends and family members.
Oh yeah.
That's just a gold mine.
but the other thing, guys, think about seeing 200 patients a week with neuropathy and running production.
oh God.
You got to have control. Now that's what we do.
Yeah, but
So
that's where your staff is trained. That's a whole nother
yes,
topic.
you got to have controls in. And so if you start altering, oh Lord, it spirals into a crap show. So if you really want to get into neuropathy and go all in like we did, um, I've got one girl running up down the hall running 3 lasers at one time with a flag system that didn't know where they're at on their foot, because of the hands-free system.
Sure.
And we've got, like I said, about 10 to 12 boot stations. We're about a laser down right now, I'll be honest with you.
We're
We
ready.
need one today.
Which do you like better? The quad? You have quad. You
Oh,
have
come on, the quad. It's the Corvette.
you like the 45 quad we just put in?
Yeah, that's like asking you want a Chevette or a Corvette. I'll take the Corvette.
I
I'll
just
take
realized
the Corvette
something.
sounds great.
You've built, like Henry Ford, a production line that's efficient with checks and balances for neuropathy.
That's
Well,
right.
and Dr. Roth, I love that you said that you brought in spa chairs because a satisfaction level just for whether we're talking about foot care or I'm going to get my nails done, well, I don't even want to say that because that's still in the profession. But if you have any sort of sensory satisfaction, whether it's like because of that specific treatment or, if I'm getting a back massage while this is happening, I'm happy. Like I have an immediate satisfaction and like a serotonin and a dopamine level that rises. And that keeps them coming back. I mean, that just creates a happy patient experience. And I just think that's something to really think about when you are putting together your laser packages and protocols. These sensory experiences are really important.
Oh yeah. I've got 4 spa chairs. They're super nice. They heat up, they vibrate, they massage, they do everything. And today was the first day I had her in the spa chair, and compared to a typical podiatry chair. And she said, "Oh, wow, I love this." She's totally happy. And she's in there for an hour and 15 minutes, give or take. So she almost went to sleep a couple times.
Well, and we've got a new handpiece coming out too, David, the massaging handpiece, which I think will make a huge impact too.
Yes,
Yep.
that's one where I call it the 8 ball. It massages as it's lasering.
Oh, that's nice.
Yeah,
So
it's
there are a lot of questions that came in about the nitty-gritty of the details, and I think those maybe are best served in an email, like putting together, some protocols and things like that that we can send out via email. There
Sure.
are a couple questions here about the marketing. So Sarah, if you want to talk about,
Yeah.
how you supplement the Remy laser.
Sure. So again, I know we've got a lot of people who have the Remy laser right now. If you've had it for a couple of years, don't hesitate to reach out to me because we've made a lot of updates as the Remy laser continues to just evolve. And David's always figuring out new ways to make this thing generate revenue for your practice. That gives me an extra task to talk about it through marketing materials for you. So I don't know if you saw the screenshots earlier, but we've got individual trifolds. So the old package just used to be a single trifold. Now we've got individual trifolds for onychomycosis, pain and inflammation, plantar warts, and then obviously neuropathy. Facebook posts. So just some simple images to tag onto your organic text onto Facebook. I took the newspaper ads out of the mix. I'll throw them back in there. It's not like I don't have the templates. So if you want, and obviously the newspaper gets a little tricky because depending on the size of the ad that you're buying. So obviously I'm always willing to work with anybody if you want to do something like that. But we have just some standardized pieces of material. And I really enjoyed the way Dr. Clements in our last webinar discussed the way that she uses the marketing materials, because she almost uses it in the moment with the patient and says, here, let's look at this. This is what we're talking about. This is what we're going through versus just, here you go, read it. I think it becomes, if you've got staff members that are apprehensive about, or just aren't confident about talking, or if they're just in their training you just brought them into the practice and they may stumble and bumble across through these words. Those materials are super helpful for your team just to have as like a crutch. So I would always recommend that you have those next to like almost like a waitress with her taking your order, like have those in your apron. Ready to just use and as a supplemental tool as you're communicating it with your patients. But yeah, I mean, David, he soups you up when you buy this laser. I mean, the price is already stupid good with all of the with all the amounts of revenue that you can bring in with this thing. And then he's going to make it 100 times easier by having me pump out marketing kits for you. So if you are brand new, make sure you fill out your marketing kit request and I'll get that on my list. If there's something that you don't have that, like maybe some of you started and you didn't do warts or you didn't do neuropathy and now you are, let me know. And I'll get you your materials to help you communicate that with your patients.
Yeah, thank you, Sarah. I think it's getting a little late, and one thing is I apologize, Ann, for going over, and two is there's lots of questions here, and I promise you I will get them answered for you separately because we'll have the email list, and we'll make sure you get. There's a lot of great answers, but we got a little off track. If I was part of it, I apologize. But there's some great questions there that I'll make sure everybody answers. I do want to announce one thing, some of the future ideas that I'm working on. And I like feedback on this. It's the Remy FX should, in the near future, be able to do diagnostic ultrasound, whether it's your equipment or our equipment, and thermo imaging. We're always trying to do things to enhance the patient experience. There is one question that I want to answer because it's an interesting one. The Rebuilder, is that a DME product that the insurance can cover? People
Actually
like
is.
Pardon me?
It is, and that's one of the reasons. And this is just me. If they're under 65 a commercial, the insurance. The problem with the rebuild, the code is the same as a TENS unit, so you're not going to get a lot. But I'm going to tell you, those TENS garments are on point. So for a rebuilder, they're only going to give you around 225.
What's
And
it
the
cost
cost of
to buy?
goods is above that. But the socks, make so much off the socks, it doesn't even matter.
Yeah, we'll
So
get it. We'll
Yeah.
have those questions. I know the Rebuilder. It's very popular in chiropractic medicine. I hope
yeah,
it can be replicated with the success both clinically. Again, it's all about patient outcomes, but
that's right.
and you'll be on tonight. You're the one that mentioned that to me before we got on tonight.
Yeah.
So
Yeah, well, I did a lot of homework. I was not a believer, but when I put it into my protocol,
Yeah.
game on. I won't take a patient without one now.
yeah,
I just won't.
I have some chiropractic friends who've been using it for years. It's very popular. It's never gotten into podiatry, or at
I
least
don't know why.
educated in
You don't
podiatry.
know. It's yeah,
So
it's
we've
yeah.
gone over. What do you think, Ann? You had enough of us tonight?
Never. But I was gonna say, just to make sure that everybody rest easy that their questions will be answered. I am able to download a report of all the questions that were asked tonight, and I'll make sure I share that with our panelists so that everybody gets answers to all their questions and the details that you all are looking for.
And I mean, David's the best at, like Dr. Sanford said at the beginning, in terms of service. So David needs his own call center, but it's just like with
Right.
a robot voice of him. Yeah, he will get those questions answered.
I promise.
Once again, it's been an honor and a privilege.
Thank you
Ladies
again,
and
Doug,
gentlemen.
and thank you, Ivar. For I'll see you.
You're welcome. Thank you. God, you're the
I
best.
appreciate all of you for coming on tonight. And if you have any questions, just shoot us an email and I'll forward them along. All right.
All right. Thanks, Ann.
Thank you, everybody.
Thanks,
Good night.
David.
Yeah.
Thanks, Doug.
Good
Night.
night.